What's up, everybody? Welcome to Resolution Podcast. Today, I'm going to be talking about something I'm going to be talking about next Monday on Fox 5. I'll be on Fox 5. This is an episode where I'm going to talk about commonly misdiagnosed conditions. And this is really important because a lot of people get surgeries because of it. A lot of people take injections because of it. A lot of people do different stuff because of it, medication. So I want to talk about some commonly injured things that people, doctors misdiagnose and do the wrong treatment plan for it. One of the main things I would say, what's up everybody on live right now? We're on Instagram live, we'll be on TikTok soon. And if you guys have any questions, you can ask me. Yes, I look like Ukrainian President Zelensky. I get that every day. But actually he looks like me. He's a good looking guy, that's all I'm going to say. And so one of the things I would say, let's start from the top, work ourselves to the bottom. I'll go about top 1 to 3 things, conditions that people misdiagnose. Number 1 is migraines. Migraines, a lot of people misdiagnose migraines. And so if you go to a doctor, you say, I have a headache, if you say anything about the head, they'd be like, you got migraines. And that's not really true. Migraine is a hormonal or chemical reaction or dysfunction within your body that causes your head to hurt. And there's a lot of different conditions, a lot of different musculoskeletal conditions that could proceed as if it's a migraine. So be like, oh, I have an aura, I have sensitive to light, I have pressure behind the eyes, and there's musculoskeletal conditions that do that too. If you go look at sternocleidomastoid muscle, SCM muscle referral pain. If you just Google that, you will see it says pressure behind the eyes, pain around the eyes, sensitive to light. Okay? And if you have that, people think it's a migraine, but not necessarily, because what it would do, you go to your doctor, they don't even examine you. They don't even touch any muscle. They don't even touch you. They just send you for a CAT scan of your brain. There's all sorts of radiation for your brain, and they increase your chance of getting cancer and things of that nature. So migraines and headaches, there's a headache. Migraine is just a type of headache. There are many different types of headaches out there, maybe upwards of 15, 20, maybe up to 30. And you can have sinus headaches, suboccipital headache, you can have the migraine, you can have SCM referral pain, you can have trapezius referral pain, you can have, like if you're a coffee drinker and you stop drinking coffee, you can have headache, hyperglycemic headache, so things that where your glucose, your sugar level is up or down, it can cause headaches. So, or typically down, hypoglycemic headache. So it just depends on the headache, it can have it. So you want to come get checked out. I recommend chiropractor and that knows what they're doing with this, because it's complicated business. That's why all these MDs are getting it all wrong. You got to kind of touch the areas, kind of examine. You can't just be like, oh, you got sensitive to light, brain X-rays or MR, a CAT scan. That's a lot of CATs. That's a lot of radiation, guys. Brain has a lot of radiation. Somebody wrote, literally, I had to tell my doctor what does it say? What I felt crazy, I figured out on my own. Look at that. Sorry, the phone's a little bit further away. But look at this. Some people are just talking to me live right now, and they're saying, listen, they literally have to tell the doctor, and the doctor didn't even figure it out. At the end of the day, they figure it out themselves. So I would say that migraine is complicated. You want to go to somewhere. My office is called Metropolitan Headache and Spine Center. Headache is my specialty, so I deal with that a lot. Sometimes you can have TMJ headache. Jaw pain can cause headache, which puts pressure. So if you have temporomandibular disorder, it can cause temporal muscles to tighten up and can cause pain right here, perceived as headache. So your jaw, if you grind your teeth, there's complicated business. Every inch your head is forward, it has 15 pounds of pressure in your back. Now you come in with neck pain, back pain, I don't care how many injections you put in your neck, how many cortisone shot you put in your neck, how much pills you take, you're always going to have headache and neck pain. So that's what it is. So I have a straight neck. So somebody wrote I have a straight neck. So straight neck is one of those things. It's called a military neck, where you're supposed to have a curve in your neck, and you don't have a curve no more. It's straightening it out, and it's putting pressure on the discs. So you need to increase that curvature by strengthening your deep neck flexors, stretching out a lot of muscles there, and then recreating that curve over time. And so that's what she was talking about. I have a little bit of a sore throat here, so I apologize if I have to cough a little bit. Excuse me. So long story short, that's what we're going with. So that's what migraine's about. And again, in a nutshell, if somebody has some questions on the live, let me know. I'll try to answer right here. But basically, that's migraines and headaches in general. Then we go into shoulders. Now, a lot of people come to me, oh, my shoulder hurts, I can't lift it. I adjust their neck, the C5 nerve specifically, boom, their shoulder improves. Why? Because a lot of times, if your brain is not fully communicating with your certain muscles, it can cause weakness. You can be like, oh, certain muscles are weak, my hands are weak, my fingers are weak. That's a problem. So not every shoulder problem is coming from the shoulder. I've had so many people, and if they went to a shoulder specialist, they're only going to look at the shoulder. What are they going to do? Cortisone injection, do 20 sessions of physical therapy. Where the problem was in the neck. The problem was in the neck. Okay? And so that's the thing we have to figure out. What is it from? That's why you really need our primary care to work, because primary care is what distinguishes where to go next. But if the primary care sends you to a shoulder specialist when it should have been a neck specialist, that becomes a problem. That becomes an issue. Because if they get that diagnosis wrong, it goes downhill from there. Then do an MRI for your shoulder. They'll be like, oh, there's nothing which is wrong with shoulder, blah, 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 blah. You know, there's a lot of other issues like that. So that shoulder can come from neck problem as well. Now, carpal tunnel. Woo! On Monday, I'm going to be talking about that next week, Monday. We're going to be on Fox 5 live at 9:30 a.m. So tune in for that. But basically on Fox 5, we're going to talk about a lot of the misdiagnosed conditions. One of the major ones is carpal tunnel. Now, what is carpal tunnel? I'm going to tell you what is carpal tunnel. This is a fact. Okay? I don't care what your doctor says. Okay? Because I've had so many doctors misdiagnose people. Numbness in these three fingers and a half of this one. That's carpal tunnel. I don't care how you want to cut it. These three fingers and a half of this one, okay? Excuse me. So, what does that mean? That means that I don't care if it's anywhere else, I don't care if it's shooting, it's numbness, tingling in these three fingers and a half of this one. Now, there's the same median nerve goes from here, because what happens to carpal tunnel, let me tell you. It gets pinched right here. There's a ligament right here, It gets pinched right here, and it causes tingling and numbness into these fingers, half of this one, okay? The same median nerve, it can also get pinched right here. It's called the pronator teres syndrome. The pronator teres syndrome is when the same median nerve gets pinched by the pronator teres muscle. And when it gets pinched with the same median nerve, it will cause tingling, numbness to the hand and actually the palm as well. So it's actually very close. The diagnosis is super close, okay? Which means that you have to get this right. So how do you distinguish? If I press here and I have tingling numbness in my hand, it's coming from here. If I press here and I don't have tingling, it's not coming from here. Or if it's both, I mean, you can have both at the same time. That's possible, right? I've had so many people get carpal tunnel. From New York City, you guys can come down. I have so many people from New York come down. So I have so many patients, carpal tunnel, they get surgery, open up, they're like, yeah, my hand's still numb, plus I have wrist pain, plus they destroyed whatever. So you want to get this right. It's important because the median nerve can get stuck other places. So carpal tunnel and pronator teres syndrome is very closely related. So we're going down from head to toe, guys, of some of the commonly misdiagnosed musculoskeletal conditions. Now, going back down to your hand, let's see, what else is there in the hand I can talk about? I'll talk about generally arthritis, okay? Excuse me. Arthritis is like, with certain time, over time, everybody will have arthritis. It's like having gray hairs and wrinkles on the inside. Okay, same with disc bulge. If your doctor says, oh, you got pain, you have disc bulge, they got it wrong. Everybody has disc bulge. 80% of the population walks around with a disc bulge, I don't even know it. Let's see, do nerve glides relieve it? Yes. Nerve glide is a good one. Okay, so since somebody asked about this is how you do carpal tunnel nerve glide. Basically, you stand to the side. Let me move this a little bit further out. Okay. Imagine, this is how I learned in school. Imagine you have a bouquet of flowers. You're smelling it, okay? Your wrist is turned in, and this actually will help with your whole nervous system, really from neck to into your hand. Wrist is turned in, your head is turned opposite direction. Breathe in, breathe out, and you open up and you turn your hand outwards, fingers out like this, all the way out, and looking towards it, looking towards the hand. You have the bouquet of flowers, you want to throw it in the river. You throw it in the river, hand out like this, all the way backward looking, and as you come back out, you bring it closer to yourself. Okay? This will open up your whole nerve from here to here, especially for people that have like tingling numbness from the neck. Because that also can be another reason. Actually, I had somebody like that. That's another misdiagnosed condition. Carpal tunnel surgery, recommended carpal tunnel surgery, but it actually was coming from the neck. So there's that. And that's called brachial plexus neuropathy. Okay? And so you can YouTube different nerve glides and for different conditions to learn it. So carpal tunnel nerve glide could be something like this, open it up. That's for the median nerve, you know what I mean? They have a lot of different stuff you can find on YouTube. You know, I have to say about all these things. What's up, Hello McFly? That's my girl. Yo, she's awesome. So I have to say with all these things, consult with your doctor. Obviously, I'm not diagnosing you here. This is just commonly treatment for a diagnosed condition that hopefully your doctor got wrong. So, with that said, you want to be able to open these things up, open up your nervous system, because that's commonly misdiagnosed, because you can get pinched here, it can be carpal tunnel. If it's pinched here, it can also look like a carpal tunnel. If it gets pinched here, it can be a shooting pain and people can make that misdiagnosis as a carpal tunnel. So those are some conditions that you have to be aware of. So we're working from the head, guys. For those of you guys who don't know, if you have any specific question you can ask. We're working from the head. We start from migraine, shoulder, we get into arm and stuff like that. But if you have any conditions you want me to say or it's some symptoms, I can kind of guide you in the right direction. So now, next, we talked about the elbow, we talked about the hand, we talked about misdiagnosis in the shoulder and neck, we talked about headaches and migraines. Next, we're going to talk about upper back. I'm going to tell you guys something unique that I don't know, 90% of doctors don't know. There's a diagnosis called T4 syndrome. I've seen one ever. These are so rare, I don't even know how I've seen it. But this person came all the way from Florida because nobody could diagnose it. Is it possible to be able to get a frozen toe joint to move again? I would have to see how bad the situation is. It's complicated, you know. But it's possible. Maybe not fully movable. Maybe fully movable. I gotta see an x-ray of, you know, how long it's been like this, things of that nature. So going back to this thing called T4 syndrome. T4 syndrome, if you Google it, it's some sort of sensation into both hands. That's all, like tingling, numbness, something like that. Into both hands, and nobody could figure it out. And basically, working on the T4, which is your upper back, will fix the tingling into your hands. Even though technically they come from the neck, your nerves for your hands come only from the neck. T4 is mid-back. There's no nerves that goes from mid-back to, but doctors can't figure it out. We just know it works, but we don't know how it works. But there's some sort of referral pain that causes some sort of sensation to the hands. T4 syndrome. It's so rare. It's so rare. Oh, another good one that doctors get misdiagnosed. Fibromyalgia. Ooh, my God. Damn. Okay, I get fired up about fibromyalgia. I've done a lot of research about it. I'm going to tell you this. I did this in school. Fibromyalgia is so misdiagnosed, I'm going to pull my hair out and chop my head off and put it right on the floor. I get pissed off every time I see it. Okay? And let me tell you this. One of the major things about fibromyalgia is the fact that you can fix it because it's misdiagnosed. So they'll be like, oh yeah, we did some blood work, they saw that you have certain vitamins in this deficiency. And they fix you. That's not fibromyalgia. If they fix you your pain through any sort of vitamins or minerals, that's just that vitamin mineral deficiency. It's not fibromyalgia. if I'm able to fix your fibromyalgia, then you didn't have fibromyalgia. I had one patient came in with diagnosed fibromyalgia, okay? I said, how much water did you drink? She was stiff as hell. Muscles were just like dry. She's like, I don't drink water. I put her on some water treatment, and within a week, she had no more fibromyalgia. She was just dehydrated. Her body was just dehydrated. And she went through so many doctors. She just needed water, okay? It's so so commonly misdiagnosed. It's wild. And it's hard for me to, I try not to fight it at first where the patient said I have a fibromyalgia. In my own head, I'm just kind of smirking, right? I don't want to say anything. But first, I try to fix them up. Once I fix them, then I have the authority. Then they'll be like, okay, this guy knows what it is. But if I just be like, nah, you probably don't have fibromyalgia, they'll be like, yo, I've been like 6 different doctors. How are you going to tell me? You know what I mean? How are you going to say you're more than 6 different doctors from Harvard? And this is actually a real case. So I don't even fight it. I'm like, okay, cool. Let me see how I can help you. And I work on them. And if I'm able to fix it like that water lady, they're like, listen, once I fix you, I have full authority. Because then they'd be like, okay, well, 6 different doctors couldn't figure it out. He figured it out. Ma'am, I'm sorry. You've been misdiagnosed for 15 years. Your body needed some water. Okay, so long story short, fibromyalgia is so commonly misdiagnosed. I fixed their fibromyalgia through just adjustments. Just because the body was hurting, the body was tight. Some water, some nutrition, and some adjustments, some exercise. So, what is a true fibromyalgia, you ask? Great question. Guys, I need some likes. Don't be stingy with your likes. There's 6 of you. I can see. Okay? I can see who it is. Likes. Bing, bing, bing. Okay? I'm just joking. It's a joke. But I'm half serious though. Thanks. Alright. So, I will tell you that what is a true fibromyalgia? True fibromyalgia is when nothing works. Water therapy, all the vitamins and minerals that we check, musculoskeletal exercise, none of that works. So how do you fix fibromyalgia? There's some medications that calm the nerves. There could be some psychosomatic issues. I had one patient, I should talk about this on the next one a little further. She came to me yesterday. Sorry, not yesterday. Yeah, yesterday was Saturday. Yeah. And no, sorry. Saturday, 2 days ago. She came with tremendous amount of migraines. Her friend practically begged her to come. I need my back straightened out. Okay. I got you, Yogi. Just link in the bio, make your appointment. Go to my website, you can, in my link in the bio, you can make an appointment. So, let me tell you guys this. She came in, I gave her one adjustment. It was one of the biggest cracks I've ever heard in my life. But I knew at that point that it was psychosomatic. I turned to her, I said, have you had any psychological traumas in the past? And she didn't want to answer. She said, she sort of said, I don't know. I said, okay. I'm going to let this one kind of settle in there. I gave her one more adjustment. And she got up. She was like, I need a break. She took some water, and I went out to get her some water, came back. I saw her hugging her friend, just crying. She's like, how did you find out? She said, how did you find out I had any psychological trauma? I said, I've experienced this before. It feels different. Psychosomatic problems feel different. This is a good one. To know the hour time. Psychosomatic problems feel different when I do the adjustment. I've had an issue where, and I won't go into too much because this is about common misdiagnosed. Well, this is sort of common misdiagnosed. Actually, they could be part of it, but I should do an episode on it. Where I've had this one guy coming, this years ago. Bald head, biker, beard up to here, tough guy. Tough guy. I gave him one neck adjustment. He just started crying and crying. He couldn't stop crying. He couldn't stop crying. I was literally in my office. I was like, okay, I'm way behind here, and this guy's good. I said, are you okay? Like, I thought I broke him. He's like, no, I'm totally fine. I feel great. I said, why are you crying? He's like, I don't know. He said, I don't know why I'm crying. I said, I don't know why you're crying either. Like, why are you crying? I've never seen this in my life. I was working at GW at the time. I went to a psychiatrist. I said, I gave this guy an adjustment, and he just started crying. What is that about? He's like, I bet you had some trauma in the past. And so what happens when the brain doesn't know how to deal with mental trauma, it actually stores it in your spine. That's why the weight of the world is on your shoulder, not physically, but mentally. And so I went up to him the next time he came. I said, I never thought, like, dude, this was a tough guy. Biker, beard, Spanish guy from Venezuela. Tough guy. I said to him, have you ever had any traumas in the past, like psychological trauma? He's like, yeah, I did. I said, what happened? He's like, I've been a political prisoner in Venezuela for 10 years. And I've been messed up since then. And I was just like, wow. I never thought he would have psychology. He was just such a tough guy. But he'd been storing it. And he just started crying and crying and crying. He couldn't stop crying. It was wild. So he's been a political prisoner for 10 years in Venezuela. And he came in with, one adjustment to his neck. He just profusely cried. So I've had a few of these cases where people come in, one adjustment, boom, they can't stop crying. Because they've just been storing it in his spine. So as soon as I did that, I knew. I said, something going on with you. She didn't want to say at first, which is fine. I didn't ask go for it because her friend was there. I don't know how much she wanted to kind of share with me. But I went for water, I came back, and she was hugging her friend and just crying. And she was having a lot of migraines for years. She went to all sorts of doctors, a lot of different doctors. And so, anyways, I did my thing. She felt great. She was like, I feel so relieved. She came into my room. She was like by herself. And her friend was like, I'm going to sit outside. And she was like, yeah, when I was a child in a different country, I won't even mention the country. In my country, when I was a child, 8, I think she said 9, I was molested many times. And now she's a nurse at a reputable hospital. It was really sad. I almost cried. For real, she was tearing up. I was tearing up. It was wild. And it was just so sad. But she'd been just coping with this, and this has just been taking a toll on her body, causing her a lot of pain. Should I do? So if you have a hernia. Copying it first version. So, I'll answer that. Let me finish my thought here. So what I will say is that another misdiagnosed condition can be your psyche. Trauma, childhood trauma, previous trauma could add up and become musculoskeletal trauma. And you go to doctor for neck pain or migraine, neurologist after neurologist after neurologist, where your mind is what needs to heal. And sometimes when I release that to feel better, then they add psychotherapy. Or actually for her case, I told her she needs to work out. Not that she was fat or anything like that. It's actually that research shown exercise helps with your mind, helps with your psyche. So strengthening, people that are strong and muscular or physique-wise, they're nice body, they're confident, they're healthier, their mind's healthier. Your exercise will help your mind. You don't have to get a psychiatrist. I mean, that has its own purpose, but she was mental. She didn't have mental problems. She didn't need medication for that. You know what I mean? Although if she went to a psychiatrist, they would have given her stress medication and this medication. All the medication that you would need, that you would get from exercising, right? So you gotta exercise. That will help with your psyche, which help with your body. So that's one of the main things I want to just kind of mention, is that will help with your psyche, which will help with your body. Psychosomatic pain is real. A lot of people have it, especially with the pandemic, especially with previous stuff been going on. People are in a lot of pain, and you guys need to address that. So, going down for our body, so let's say somebody asks, should I do cupping with chiropractor? Should I do cupping with chiropractor? It's two different situations. Should I do a cupping session or a chiropractor? Of course I'm going to say chiropractor. What's cupping? Cupping is a vitamin. Cupping is a vitamin, it's not the medicine. So I use cupping too. It's not the vitamin. So if my head is like this, I'm gonna have a lot of shoulder pain. I'm gonna have all the pain. Guess what? Put cupping, I'm gonna feel great. But guess what? My head is still like that. So the only way you're gonna get better is if you stand like this. First, we have to fix your structure. Then you can do cupping as a vitamin, as a side thing to it in addition. But I wouldn't be like, should I do this or that? You really need both, but you really need the string up first. First, you have to make sure your posture. I mean, I'm sitting right here. You guys can see good posture on me, hopefully. Try not to slouch, but that's how it works. If traveling to the most amazing chiropractor is an option, how do we go about finding a good one on our area? So, let me see. Okay, how do you find a good chiropractor? Good question. Number one, I would say probably Google reviews. That's probably going to be your best bet. Word of mouth, things of that nature. But that's how you find a good surgeon and a good lawyer and a good dentist, especially when it comes to any sort of situation where it's the hands-on work. This is not a primary care where I can just be like, I can write the same script as he can write the same script, or she can write the same script. This is a treatment where I have to do it by hand. So there's a science behind it and there's art. And if you're not good at either one of them or one of them, the whole thing just collapses. I have had in school colleagues that get straight A's. They come into practice, they can't do the adjustments, right? And I've had patients, I have colleagues that are great adjusters. They can't get the right diagnosis. So what's that? So you got to know the science and art. There's a mixture that you got to have both. So just like we have a good surgeon, there's two surgeons. They both have the same licensing. They both can do the same treatment, but one's world renowned, right? One gets a harder case. But if your case isn't hard, you can sort of go anywhere. If it's just like I have some tightness. But if you've been going to doctor, nobody can figure it out, I would suggest you should go to one that's really good that i.e., and then from there I can figure out, okay, this is what the diagnosis is, and you can go to another chiropractor. I can just write it down. As long as they have good reviews, they can just do my treatment plan, boom, 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 and you'll be good to go. So that's one option. Another option. So you can Google review it, just take a chance. You can come here, we can diagnose you right, and then send you off, and word of mouth. That's sort of how you find the right chiropractor. Now going down to, let's see, I'm going to stop right here. I'm going to go on TikTok, guys. If you have any questions, DM me on IG. We'll go over it. We went over headaches all the way down. So we're going to leave the other half of the body for next week. I appreciate you guys tuning in, downloading. I appreciate everything, all your support. Tune in for another episode of Resolution Podcast next week. Boom.